What to do when your back hurts from scoliosis. Scoliosis is not always painful, but however, scoliosis is a spinal condition that involves the development of an unnatural curvature of the spine with rotation. No two cases of scoliosis are the same. There are a different number of patient conditions and variables that factor to how painful a scoliosis could be or not be. Like I mentioned, not all cases of scoliosis develop pain, but however, there are some significant variables that are more associated with pain, and the most common thing is going to be patient age and the severity of the scoliosis. Now, patient age has to do because scoliosis isn't commonly painful for children and adolescents because most of the time these patients are growing as their curve progresses, and this growth causes the body to adapt around the scoliosis, not leading to any kind of compressive conditions. So therefore, it doesn't initiate any type of pain or discomfort. However, once skeletal maturity has happened and there's no longer growing, this can lead to scoliosis becoming compressive. In patients that are still growing, the lengthening or the growing not only counteracts the compression, like I mentioned, but it is also when the body is most adaptable. So they're growing around the curve. And since they're growing around the curve, the body's adapting and growing around the curvature, and things are changing as a result of it. But it's when the compression starts to occur in the spine, especially to surrounding muscles, joints, nerves, and tissues, this is when the majority of patients experience the pain related to scoliosis. Now, unfortunately, scoliosis can progress in its severity, and that range is very, very wide, meaning curves that are diagnosed as severe or mild can still progress. So even if you have a mild scoliosis, it can progress to moderate to severe, where severe scoliosis can progress into very severe scoliosis. So where scoliosis is at its time of diagnosis doesn't mean where it's going to stay, and especially if it's untreated, and especially if it's not treated in a proactive manner that's going to try to reduce the size of curve. Since we know scoliosis has a wide range of mild, moderate, severe, and very severe, it's in its very nature to worsen over time. We expect to see curves worsen, unfortunately, if they're not treated. Now, generally, the more severe the condition is, means the more further out of alignment the spine is, the more likely the scoliosis is to be painful. So therefore, a severe scoliosis is more likely to be painful than a mild scoliosis, because normally the size of curve is also related to how much the curve or the spine has rotated or twisted. And this degree of spinal rotation is also an important factor in determining how much scoliosis pain the person is going to experience. So size of curve means typically greater rotation, which typically means more pain. However, we know as patients move into the adult phase, this is the most likely time they're going to experience pain. So you can have a severe scoliosis as a child, feel no pain at all, move into the adult form, and now this scoliosis is going to begin to cause you pain. And the reason why is because in the adult time is when you're no longer growing and adapting around the scoliosis, you're no longer elongating, and now gravity is taking effect, causing the spine to compress. And this compression can now affect the nerves and tissues, which will almost always lead to pain. It's just a matter of time. So I always like to tell patients, the size of curve is related, but typically it's how much you worsen in the adult form that's going to dictate how much pain that you feel. So for example, a child can progress to like 60 degrees, have a severe scoliosis, and hold their curve at 60 degrees their entire life afterwards as an adult, and may experience hardly any pain. Where you can have an adult progress to 20 degrees as a child, mild scoliosis, go from 20 to 30 in the adult form, meaning 10 degrees, go from mild to moderate, and that 30 degrees that 10 degrees progression in the adult can lead to severe pain. So it's relative to how much you progress in the adult, not necessarily just your total number. But the bigger your curve is, the more likely it's going to progress faster in the adult form than having a smaller curve. So therefore, it is related to size because it's more likely going to progress in the adult, but it's really related to how much your curve actually progresses in the adult form. In the adult form, the number one thing it tends to lead to is something called muscle pain. And muscle pain is very common because because of the asymmetry that's occurring in the spine. This asymmetry causes muscles to stretch and become loosened over time. And as a result of it, they lose the leverage to lift the body properly. So muscles have to overwork. And since they're overworking they tend to cause tightness and stiffness. The second most common symptom associated with scoliosis is nerve-related pain, because as the spine starts compressing, it starts compressing on those nerves, which can lead to radiating pain, typically into the lower extremities, like into your leg. It can lead to the sciatic types of symptoms. It can lead radiating pain into your arms and hands if you have a scoliosis in your upper back. So number one pain problem is definitely muscle pain, and however, nerve-related pain can be more common in adults. Now, sometimes even children can have muscle pain while they're growing and developing, but typically it's considered to be a mild pain that normally resolves itself with rest. It's not like in the adult form where it can be more constant. Now, in addition, can not only have muscle pain and they can have nerve pain, but they can also feel like a sense of stiffness. And the reason why there's a sense of stiffness, because as curves get bigger, their motion becomes asymmetrical, meaning as we take movement x-rays or movement studies of scoliosis patients, we find that when they bend a certain way into the concavity of their scoliosis, that they can actually increase their curve, but when they bend away, their curve decreases, but it doesn't move at the same rate. So they feel stiffness because the spine isn't symmetrically moving left to right. So they have this sense of stiffness. So the best way to relieve scoliosis pain is to actually address the scoliosis. And unfortunately, that's not the most common way scoliosis pain is treated, which I find quite fascinating, that when patients know, oh yeah, I have scoliosis, and then you go in and they say, oh yeah, I have scoliosis, I'm having some back pain. They don't address the scoliosis. The majority of the time, they're just treating the symptoms of the scoliosis, which is the pain that you're feeling, with medications or some general physical therapy or some stretching or some therapies that help to try to relieve your pain, but your scoliosis is still worsening and progressing, which is more likely going to cause more discomfort and more pain as that happens. So truly the best way to deal with what you're feeling with scoliosis is to actually reduce the scoliosis. The smaller you make your curve, the less compression that's going to occur, the less progression that's going to occur, and therefore you're going to proactively stop further problems by actually treating the scoliosis itself. So therefore, our recommendation is that if you have scoliosis and you're having pain and symptoms as a result of it, is to treat the curve, not just the symptoms of the scoliosis. Now, scoliosis can be treated or reduced traditionally with invasive and risky spinal fusion surgery. And this is done to actually try to reduce the size of the curvature using rods and screws in the spine. Now, unfortunately, this type of treatment has its own risk associated by increasing pain and discomfort as a result of surgery. The goal of these surgeries are not necessarily to reduce pain, just to try to stop the scoliosis from progressing. So normally when they do these in adolescent cases, they're not necessarily expecting the patient to be pain-free afterwards. And in adult patients, it's normally very risky for them to do this spinal fusion surgery. So therefore, they normally wait for adult patients to not only be in pain, but in severe pain or have severe disabling pain before they risk the surgery, because the surgery can lead to more issues. Now, good news is that there's other options to treat scoliosis, and it can be proactively treated with something that we call a modern conservative treatment approach. And these modern conservative treatment approaches typically combine many types of treatments into designing a very specific rehabilitation program or treatment approach for scoliosis, not only to manage the symptoms of scoliosis, but actually to make the curve smaller. By reducing the size of the curve, you're actually treating what's causing the problem. This conservative treatment approach is typically chiropractic centered. And the reason why I say it's chiropractic centered, because chiropractic goals are typically to address the cause, not just the symptom. So our goal is not only preventing progression, but actually reducing the size of the curve by improving things like pain and malfunction that could be associated with the scoliosis. And we do this by treating the scoliosis as soon or as close to the time of diagnosis as possible, because we know the smaller curves respond better to this type of treatment, and we know younger patients respond better to this type of treatment. However, I've treated very severe scoliosis cases, 120, 130 degree cases using these methods, and I've treated patients in their 90s using these methods. But generally, smaller patients, younger curves do better. These conservative treatment approaches, like I mentioned, integrate many, many different disciplines associated with scoliosis treatment. It's not limited to just chiropractic care, even though I said it's a chiropractic-centered approach. It's not limited to just the traditional chiropractic adjustments that people associate chiropractic care with, but it's also using therapy and rehabilitation and exercises and corrective bracing and neuromuscular education and many different things to help make the spine straighter. And the goal, I like to say, it's structural rehabilitation or structural therapy. It's not just for muscle strength. It's not just for range of motion. It's not just for trying to reduce your pain. It's trying to do all those things by making the spine actually straighter. And the way this actually works is that every therapy increases the effectiveness of the other. So uses chiropractic care. We use physical therapy and rehabilitation to help increase strength and increase flexibility and mobility. We use corrective bracing that help pushes the spine more into a corrective position. We use rehabilitation and home therapy, scoliosis-specific exercises, and to help in home programs to help further stabilize and help the spine heal. So we know when it comes to treating scoliosis pain, there are definitely short-term things that can be done, like medications, general strength exercises or stretches or yoga or heat. But really for more long-term sustainable pain management, the best remedy is to reduce the size of the curve. And that means treating the scoliosis, not the symptoms of your scoliosis. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.